Hello, everyone. Good evening, and thank you for joining us this week for Sisters of Legacy. We appreciate you guys. We're gonna run our intro, and we'll be right back. All right, you guys, we are back. Thank you again for joining us. As always, we have the lovely Shanetta
Hey.
and awesome Trina below.
Hey.
And I am Samantha. This week we have a special guest for you guys. We have Dr. Ariana. I'm probably saying that not quite right. Ariana Frank. She is a dentist, so we're going to bring her on. She is going to enlighten us on the proper ways to care for our teeth and all the ways that can affect us. So let's welcome in Dr. Frank.
Hi.
Hello.
Yeah. So yeah, my name is Dr. Well, I like to go by Dr. Ariana or Dr. Ari.
Okay.
I'm originally Poughkeepsie, New York. Born and raised, and I started off at Dutchess Community College. After that, I then went on to Marist College, and I got my bachelor's, and then I went to City College, got my master's, and then I went to Temple Dental, where I graduated in 2019. So.
Wow, that's a lot of schooling. Does it really require that many years to become a dentist?
So no, it really requires, I want to say 8 years, like 4 years of undergrad and then 4 years of dental school.
Okay.
I decided to do the extra 2 years in between and get my master's because there are not as many dental schools in the nation as there are like medical schools. So that makes dental school that much more competitive. And so in order to make myself more marketable, I decided to go ahead and get my master's, and it worked out. So.
Okay. And did you grow up always wanting to be a dentist?
Yeah.
Okay.
Yeah, I don't know. I was always interested in the medical field. So like I was interested in math and science. I knew that I wanted to do something in the medical field. But I wanted to have a better like work-life balance. And I didn't want to be on call in the middle of the night. I wanted, to eventually one day have a family. And I feel like dentistry kind of, provides like that, like work-life balance. And then also the main reason why I, decided on dentistry in particular is because I used to do hair growing up. Like that was my little business. And I used to do Trina's daughter's hair all the time.
Yep.
And I like making, people look and feel better about themselves. And I feel like to an extent, yes, dentistry does have the medical aspect to it, but I feel like to an extent, all dentistry is also cosmetic. And so it not only allows me to educate people, but also make them look and feel better about themselves. So.
Okay. Awesome. I just want to say, listen, as far as dentists go, you are a very pretty dentist because I always get, like I've always had dentists that look like they don't even want the
Sam.
job. They don't like it. They look unhappy. Oh. So I had to see if you was my dentist, I might feel better coming to get into the chair.
Thank you.
So do you find like the dental profession is there a lot of female dentists or
So I feel like now there is. I think in my graduating class, it was about 50-50, to be honest with you. So I feel like in the beginning, it did start off as like being like male dominated, but now more and more women are entering the field because of like that work life balance and because it offers like, a lot of like independence as far as schedule goes, like compared to, women in like traditional medicine, like being like a doctor where you're, called in like all hours of the night. So yeah, there aren't that many blacks in the dental field though. So that I
Okay.
will say, I was the only one, only black
Wow.
person in a class of 140. So
Wow.
yeah, yeah,
That's
that
interesting.
was tough. That was tough.
Okay, I don't want to monopolize. Anybody got any other questions? I want to give everybody a chance to.
Um, just with regard to, is it me that's echoing? Anybody else hear the echo?
I hear it.
I hear it. Yeah.
Oh, I don't hear it.
Okay. All right. Well, I'll just keep going then. With regard to our community, um,
Hmm.
Black people, do you find in like in practice that there are disparities as far as how much we go to the dentist? Do we come in as much as we should? Um, and if there are disparities, like why is that?
So I feel like yes, yes and no. I feel like I can't really say that it's related so much to race. Like definitely, like I feel like there's definitely, a disconnect like when it comes to like us, like our community. But I feel like maybe like just the lower income community in general. And I just feel like a lot of it is due to lack of education. They just don't know, Um, when I was, for an example, like when I was at Temple, um, there was a girl, the same age as me, like I think I was like 28 at the time. And she said that, the first time she ever went to a dentist was when she was 16 years old. And like she was in and out of like foster homes and things like that. But like they're just not taught of the importance of, dental health and like oral health. And as a result, she was my patient, but I was getting ready to extract basically all of her teeth and give her dentures at the age of 28, because she was just never taught, and so I feel like a lot of it has to do with lack of education, number one, and number two, some of it has to do with phobia. Like some people are just, generally just scared of the dentist, and then there are some people that are intimidated, considering the fact that there are not a lot of dentists of color out there. A lot of blacks, especially, I find like, they're very intimidated. They see this white man, they're using all of these, the white man or woman, they're using all this terminology that they don't understand. And then a
Right.
lot of times the black patients, they don't want to ask questions because they don't want to seem stupid or they don't want to seem ignorant, So I've been in situations also at Temple where, because, Temple is in the middle of North Philadelphia. So all of our patients were black. And so I feel like I really excelled in clinic because I was able to relate to patients on a different level. And so like we would have like clinical like professors that would like explain to the patient, what they need done, why they need it done. Again, using all this terminology that they don't understand. And the patient will nod and say, yeah, yeah, yeah. And then as soon as the doctor would leave, they turn to me and say, okay, yeah, what did that mean? Like, can you translate that for me? And then I was able to explain it to them in a way that they would understand, and so yeah, I think a lot of it has to do with lack of education.
Wow.
One thing I'll say is that um even though for me, even though I'm educated, whatever the case may be, the two law firms that I worked for, both of
Mhm.
were big firms. Neither one of them offered dental insurance, and I was like, wait a minute, I'm thinking I'm arrived or whatever. You know what I'm saying? And neither one of them offered any type of dental insurance. And I'm thinking to myself, well, maybe they thought they paid me enough to pay out of pocket. But no, when you got a $50 copay, it's a
Yeah.
lot. So I know that, some, state jobs or whatever, they have good insurance, but a lot of people don't have good dental insurance. Have
Yeah.
you found that as well?
Yes, I do feel like, I do feel like dental treatment isn't necessarily valued, by insurance companies. I mean, a lot of it is due to our own fault. There are dentists that take advantage of the system, like, back in the day, it wasn't required, for you to send x-rays like to prove that you did a root canal or did a crown or something like that. So dentists, they were committing all this insurance fraud, and they were claiming that they completed all these treatments on these patients with no proof when really they didn't do anything. So I feel like a lot of that, it's kind of messed it up for a lot of us, and as a result, I don't feel like, dental treatment is as valued. um but and I kind of like lost my train of thought. But um yeah, what was the
I mean, I was
question
just
again?
asking if, if, go ahead. I was asking if you found that a lot of people don't have good dental insurance, even though they're working good jobs and stuff.
Yeah, so dental insurance is something hard to come by as well. So I work at two different practices. I work at one in Poughkeepsie and one in Hudson. The practice in Poughkeepsie, he does not participate with insurance at all. And so most people that are coming to the office, they're paying primarily out of pocket. And a lot of it, a lot of it is because, even when we do have, like, these dental insurance plans, what patients don't realize is that, like, for like, insurance is essentially like what he called like their coupon. Like, they never really pay for what it is that you need. So, like, for instance, like, we may charge, like, I don't know, just throwing in like $200 for an extraction. If you participate with an insurance as a provider, a lot of times insurance companies, they'll only want to pay, like, I don't know, maybe $50 for a $200 extraction. And so if we decided that we wanted to, participate with that insurance, we would be taking a pay cut. So in order for us to make up for that pay cut, we have to increase the production. When you increase the production, you decrease the quality of the work. So it's this whole like network of things. But yeah, there are a lot of patients that come in that don't necessarily have good insurances, and our hands are tied because there's really not much that we can do about it. So,
Wow. Okay, so I have a question. I don't know. I think I read somewhere or heard somewhere that I don't know, lack of care for your teeth or for your mouth in general could lead to like heart disease or something.
mm, yes. So you have like millions and millions of bacteria that live in your mouth. And you have something that's called like bacteremia, and that's like basically infection that of the blood that can originate from bacteria that's in your mouth. It can travel through your bloodstream and it can infect your heart. And so another thing is that a lot of people, they don't realize that lack of dental care also is associated with things like heart disease, diabetes, things of that nature. And generally, and not all the time, but a lot of times when you know when you see a patient that doesn't have good dental hygiene, it's generally an indication that the patient really doesn't have good overall health in general. Because if they're not seeing the dentist, that a lot of times they're not visiting the regular doctors. So there are a lot of times where you know you'll see manifestations of certain diseases in the mouth. Like, for instance, sometimes you can recognize like blood disorders. Or I've had, one of my mentor, he's like, just by looking at, the tissues in the mouth, like he's caught early stages of oral cancer or esophageal cancer. Just by looking at the condition of the teeth, you can tell a lot of different things going on that people wouldn't normally recognize. So yeah.
Wow.
It's all tied in together.
Okay. Hey, Mother Norris, thanks for joining us. And hey, Lise, good evening to you. Okay, so
I have a question too when you get a chance.
go ahead.
At what age do you recommend that dental care start?
um, so I would say as soon as your child develops their first tooth. So, what is that, like 6 months or something like that? And granted, like it wouldn't be like, doing anything extensive, but just to bring the child in, just to get them used to being in a dental chair, just to make sure, again, like all of like their oral tissues like look intact and there's like nothing going on. But I would say as soon as like the appearance of the first teeth. Some people like to wait until like 3 years old, where they at least have all of their set of teeth. But then sometimes, by that time, depending upon like home care, I've had 3-year-olds that have come in, with a mouthful of cavities. And so if you wait until then, so in some instances it may be too late, and you don't want to traumatize a child. You don't want their first dental visit to be a bunch of fillings. You want it to be a pleasant experience. So I feel like starting them as early as you can, like the appearance of the first couple of teeth, just to get them used to, we say we're going to count your teeth and we're going to polish your teeth, and just or practice brushing with them, just to kind of get them used to it.
Okay, so let's just say you're like an avid brusher. I don't know what's normal, twice a day. Let's just say somehow you brush 3 times a day. Like you're an overzealous brusher. You brush all the time and you floss too, right? Is
Mm-hmm.
that enough to maintain good oral health, or is seeing a dentist absolutely necessary to
Um,
maintain oral health?
I think that and it, yeah, I do think that seeing a dentist is absolutely necessary. I mean, you should go, to OBGYN and get your regular checkups, and you should go to the doctor and get regular checkups. And a lot of times, patients, they only visit when they have a problem. And normally when you have a problem, it's too late. Even if you do brush and even if you do floss, like some people, just based on, their biology, like they're more susceptible to cavities, they're more susceptible to gingivitis and bone loss. And if you want to halt the progression, or if you want to catch things early before it's too late, then it is important to go in, get your regular x-rays. I mean, and there are patients, they come in for years, just getting cleanings, and that's it. They don't need anything more. But at least we're able to catch something, or we're able to at least monitor, just in case something were to pop up unexpectedly.
Okay. And if you got to a position where you felt like your children, like they lost their baby teeth, they got their regular teeth, and they come in crooked, so you're gonna get dentists. I mean, get braces.
Mm-hmm.
That's what I meant. What age would you recommend a child getting braces?
So that, I believe it's after. Well, see, that depends. So I'm not an orthodontist, so
Oh, okay.
that
I'm
is
sorry.
still, no, I probably should know, but I'm still learning. So, but I would say maybe around preteen age, like 11, 12, 13. Um, if it were me, I would prefer to, start them with the braces, or ortho treatment, once they have all their adult teeth in. But then I do know that there are some individuals that do start ortho treatment even when they do have baby teeth, and then they just adjust accordingly. Um,
Oh,
but I would say like preteen age. Yeah.
okay. So you said you're not an orthodontist. So what are the different types of
So
dentists?
So there's general dentists, and that's what I am. We just, kind of just cover a wide range of things. There's orthodontists, they do braces, they do Invisalign. There's an
Okay.
oral surgeon, they do all the extractions. There's an endodontist, they specialize in root canals. There's a periodontist, that specializes in maintaining the health of the bone, and the bone is what kind of like keeps your teeth in place. Um, there's a pediodontist, and they specialize in the treatment of children. So yeah, there's many different specialties. But I mean, as a general dentist, you're able to dibble and dabble in a little bit of everything.
Okay.
And so I pretty much, I have experience with everything except for orthodontics. So that's the one thing that I
Okay.
don't have much experience with yet. But as far as everything else, I do dentures, I do extractions, I do root canals, I do crowns. I pretty much do, yeah, everything else. So,
Okay.
No, it's a lot.
No, no, you're right. I'm trying to process because I just dentist, like
Yeah,
dentist. That
dentist.
if I
Yes,
need my tooth pulled, I'm going to the dentist. If I
yes,
need
yes,
braces, I'm going to the dentist. That's it.
yes, yes, yes.
I think we generally just lump it all in
Yeah. Hmm.
together.
Mhm.
So yeah. So is it normal to see people with a fear of dentists?
Yeah, it is. It is. I mean, and a lot of it is caused by like bad experiences, you
Right.
know. Um, a lot of people, because I mean, there are some good dentists out there, but then there are some, like you were talking about before, that look sad, like they don't want to be there, they don't really engage with you, and on top of all of that, they're in your mouth. You don't know what's going on. You don't know why they're in there. You don't know why you're getting the treatment. Like it's just so much going on. And so yes, it is common for people to come in with phobias. um but I don't know. I like it. I like to think that I specialize with people that are scared of the dentist. I always end up making them feel pretty comfortable. So
Do
I
you ever
think my
use?
question is
Go ahead.
about the X-rays that you get when you go to the dentist.
mhm.
I kind of feel about the X-rays at the dentist office the way I do about mammograms. I feel like there has to be a better way, and I'm just like
I
still trying
wish
to
there
figure out
were.
like
I'm with you on that.
with all this technology, can we not like like pull my entire mouth open and like
Yeah.
press down on something that's
I'm with you
uncomfortable
on
in
that. I am definitely with you on that. I wish. I don't know. I'm hoping somebody invents something in the coming years, because I'm tired of it too. Like, 'cause sometimes I have to take my own X-rays, especially if I'm doing a root canal or something like that, and it can be a pain sometimes. So I'm
yeah.
definitely with you on that. Yeah.
Okay.
So
So, oh, go ahead.
do you use the it's laughing gas, but it's nitrous
Mm-hmm.
oxide? Do you
Nitrous
use that
oxide.
to help
Yes.
people?
Yeah. So first, I personally don't like using it. But we do have it available at the office. For people that want it. I just don't like using it because it's like this whole like this like nozzle like nose piece that goes around the patient's mouth, and for me it's like it's distracting because it's like a lot of times like it limits the opening of the patient's mouth, and I'm trying to focus on this, but it's just too much going on in the same area. So I try not to use it as much as possible. If the patient insists on it, then it, of course I'll give it to them, but most times I try to calm the patient down and try to use my own techniques, so that they won't use it. One time I remember I was like singing Twinkle Twinkle Little Star to one of my patients as I was giving her an injection because she was just that afraid. So, but I mean it worked. But I mean, yeah, you'd be surprised. You're dealing with so many different people, so many different personalities. Like, yeah, it's fun. It gets fun sometimes.
All right. So we have a question. He said, "Can they just knock you out and work on your mouth?"
Yes. So they can do one or two things. So it depends on if you just need like extraction, like a lot of times the oral surgeon, they can either sedate you. So you're not completely knocked out. I mean, you're semi-conscious, but they can, sedate you and then, take out your teeth, or they can put you to sleep like under general anesthesia in the OR. And so they do have, things like that. But I mean, I even that, like I wouldn't recommend it unless like you're extremely, extremely, extremely phobic, or you have a condition that doesn't allow you to function in a regular dental setting. So like when I was in residency, like we saw a lot of patients with special needs. And a lot of like they definitely cannot function in a regular dental setting, so they have no choice but to be put under in order to get fillings done or even a cleaning done, because otherwise they're not going to cooperate. So I mean, I really wouldn't. I mean, unless it's that serious, I don't I don't think you need to get knocked out to get anything done like
Right. He said, "I want to go night night
that.
and wake up
Wait,
done."
and done.
Listen, this is my husband who is scared of the
Really?
dentist.
Oh,
I
why
mean,
is he
he
scared
goes, but
though?
it's rough for him. Like
Really?
he had braces before or retainers or whatever. Him and the dentist has always not seen eye to eye.
Oh man.
He go to the dentist and come home angry.
Oh no.
Angry.
Wow.
I'm sorry.
So yeah, he probably definitely wants to be knocked out.
Oh.
So before we started, I kind of asked you, and I told you I was gonna ask. I'm gonna ask online because I know there's people that's gonna watch this video or are watching now, and they wonder the same thing. So when you meet people, right, and they breath meet you from across the room, is that
Mhm.
always? I know that's always not just a lack of brushing. So like,
Yes.
you know, is halitosis a real condition?
So
And and where does it come from? And how
so
can we send it back?
yes, so yes, halitosis, it is a condition and it can come from a variety of things. Dry mouth can be one of them. Sometimes like some people like they don't like brush their tongue and you have like a lot of because I mean your mouth you just have like bacteria just living in your mouth at any given moment. So I mean it's just like you have bacteria just living on your skin, it's everywhere, right? And so like sometimes you have an
It's making me
overpopulation.
itch. That's it just don't sound good. But
So
go ahead.
so sometimes you have a overpopulation of bacteria, especially in your tongue, like due to lack of brushing your tongue. That's another thing. Some people have the tonsillit. So there's a little calcified kind of like deposits that form in your tonsils. Have you ever like caught like I've had them sometimes. You ever like cough up like little like balls? It looks like little like cottage cheese balls that smell. No, okay. You have it's called tonsillits, and it's like little calcium deposits that just naturally just form in your body. So that can cause it. And then also there's this really nasty condition called periodontitis. And so I feel like if anything, that's like that's like the culprit of halitosis. And it's basically where, and it normally happens in patients that haven't been to the dentist in a while. And you have like layers and layers of plaque that just build up on your teeth. And essentially that's just, it's plaque is it's a colony of bacteria. That's really what it is. And so when you have patients that haven't been to the dentist in years and they have like, this like plaque that's like this thick that's built up on their teeth. And yes, it happens because, I see it all the time. And we call that, perio breath. So that's, equivalent to the halitosis. So yeah, it's caused by a number of things, but
Listen, you make all of this sound so disgusting. You said an overpopulation of bacteria in your mouth. It makes you not want to even open your
Well,
mouth and talk.
well, that's why, people have to brush their teeth. That's why they have to floss. That's why they have to keep everything under control because yeah, it's real. People they think, you know, having healthy teeth is just all about having white teeth, but it's more than just, I mean, that's the first thing they say, I just want my teeth white and bright. But it's more than that. Like, no, they need to be healthy. Like, otherwise, you're dealing with, more issues. So yeah,
So
Do you,
how many times a day do you recommend brushing?
I'm gonna bleach my mouth. I recommend brushing twice a day, once in the morning and once at night. To be honest with you, I'm still working on brushing at night because sometimes I'm tired and I don't like brushing at night. But anyways, that and then at least flossing at least once a day.
Oh, I have another question. So I bought
Mhm,
this thing, or my husband bought it for me, but I had talked about it for a very long time.
mhm.
Um, called a water pick. So
Yes.
tell me what you think about water picks and tell me like how do you feel about like skipping flossing versus using the water pick. I call it a very expensive toy pretty
Mhm,
much
mhm.
for brushing, but yeah, tell me what you think about that.
Well, I've never used the water pick to be honest with you. I'm just a traditional flosser. I've never used it. Um, I guess it's for people who just, never really took to flossing and it's just, a way to kind of get people just like they had like the electric toothbrush to try to get people excited about brushing. Like that's what I don't know. I can't say that it's any more efficient, because I have patients that come in that use the water pick, and I have patients that come in that use traditional floss, and I don't really see a difference in the health of their gums as long as you're doing something.
So
So
not both of those things, one or the other.
you can do both, but I think the water pick was kind of like designed to replace, the traditional floss.
Okay.
So yeah.
What do you think about those tongue scrapers?
Oh yes, absolutely. Yeah. Because that's one of, yeah, because like the overpopulation of bacteria on your tongue, that's one of the causes of halitosis. So I would definitely use a tongue scraper to kind of get all of that. And then even when you use a tongue scraper, like at least when I do, like, you see all the stuff that comes off of it. And it's just like
So is brushing your tongue just as good as a tongue scraper, or you
I think
recommend the tongue scraper is
um
better?
I would say I would say that the two are they're both pretty good. Yeah, I can't really say one is better than the other. I don't have research, like everything in dentistry is like, they want to compare, have the controls, and I don't really have anything to compare, but
Mhm.
I've seen a difference in me doing it versus not doing it. And I've used both the tongue scraper and I use my toothbrush. So and I don't really see a difference.
Okay. So are there foods that are like, well, I guess that can be kind of detrimental to your teeth?
Hmm. So anything with sugar, basically.
Wow, okay.
Anything with sugar. Coffee with sugar, honey, candy, any, because the bacteria that, already live in your mouth, that's what they feed upon. They feed upon the sugar. And so it's easy to keep that, those bacteria at bay, as long as, you're doing your flossing and you're doing your brushing. But if your diet is high in sugar, like, sodas, juices, whatever, carbohydrates, really fatty foods that eventually break down into sugar, it yeah, that can be detrimental because the bacteria, dang, anything with sugar. Yeah, I mean, my suggestion is that you limit, your sugar intake, and then if you have, a late night snack, cookies or whatever before you go to bed, just in that case, then I would say it is important to brush your teeth right after that or something like that.
Can
And
you
then it
recover
also,
from
and
poor
then it
dental
also
health?
has to do. Hmm?
Can you recover from poor dental health?
Um, yeah, I mean, so the thing about dentistry, unfortunately, is that um once the damage is done, um there's like it can't be reversed, so once you have a cavity, you can't undo a cavity, or once you start to lose bone, like you can't undo that. So it's just a matter of, that's why we use a lot of preventative measures. And that's why I say it is important to go, to the dentist every 6 months to get your checkup, because if you wait 3 years and you have an issue, like at that point there's no turning back. And the things with another thing with like dental problems is that people think that with dentistry, oh well, my this tooth used to bother me, it doesn't bother me anymore, it's on and off or whatever. The thing about dentistry is that nothing things don't get better, they get worse. So my word of advice is, if something's bothering you, see the dentist as soon as possible. The earlier that you catch things, number one, the cheaper it is on your pocket, and number two, the less agony that you'll be experiencing later on, because it's like, you have people that come in, they haven't been to the dentist in like X number of years, and they need a bunch of teeth pulled, they need root canals, and they're crying about the bill, and they're crying about losing teeth. But it's like, well, had you been coming in all along, these started off as cavities. We could have just filled them. It would have been something as simple as that, and it wouldn't have progressed to this moment. But when you start, when you use avoidance and you don't value going in, it's like problems get worse, and it just gets to the point where our hands are tied. Like we're limited with how like what we can do to help. So.
That's definitely true because a lot of times when it comes to our health, we definitely wait until there's a problem. And that's like across the board. It's like if it's not hurting, then I'm
Mhm.
good. If I don't have any pain or what I'm saying, if I don't
Mhm.
see or feel anything negative, then
Mhm.
I'm not going in. So that's like what you're saying is like by the time you get there and it's a problem, then it's a real problem. So,
Exactly.
it's definitely important, like you're saying, to, be preventative, I think.
Mhm. Mhm. And just another thing too is like cavities. Cavities don't hurt. A lot of people say, "Oh, well, I didn't feel like it wasn't bothering me." Yeah, it's not going to. Once it starts bothering you, then that means it's going towards the nerve, and it's something a lot deeper than that, and you don't want to do that. And so, considering the fact that it's not going to bother you regardless if you do have a cavity, that's all the more reason why you need to be visiting the dentist regularly, getting your x-rays regularly, because your body's not going to detect it until it gets to a certain point, you know.
Yeah.
So, do you recommend like once, I think one of my teeth was, I don't know, it was doing something. And so they kind of gave me a choice, do you want to pull it or do you want us to fill it or do something? I was like, pull it out. Like,
Hmm.
so do you recommend like trying to keep as many in there as possible or
I do. Just because you only get, like, once you get your adult set of teeth, you only get, like, that's your only set. And, like, there's nothing else is gonna grow back in place. Like, it's like that's all you have. So I recommend keeping as much teeth as possible. And not even that, but it's like, I have patients that come in, it's like every time they have an issue, is pull this tooth. And I've told them, I said, before you know it, you're not gonna have no teeth left. You're telling me to pull all these teeth, and if every time you come in, every 6 years you're getting a tooth pulled, pretty soon you're not gonna have nothing. And it's like, I don't know. To me, it just baffles me because I mean, they're like, oh, well, I'll just get dentures or I'll just get implants, whatever. But I feel like even with that, it's not an end all be all solution, because even with that, like, you're adjusting and getting used to having something foreign in your mouth, like that comes with its own challenges as well. So it's like, in my opinion, it's just so much easier to keep and maintain what's already in your mouth, or designed to be in your mouth, than to put something foreign in there. So yeah.
yeah,
I
listen,
would
I'm
say
like
if
you.
you can.
You only need a few, just enough to be able to chew.
No, ma'am.
No, so that's true. That's true. But then, but when you pull all of them and you like, what are you gonna
Listen, that getting it filled or the like, I've never
do?
had a
It
root
was probably
canal.
a root canal. Yeah, it was probably a root
Well, I've never, thank God, I've never had one of those, but I've heard such horror stories. And it seemed like they take so long. You can't
canal.
be in here digging for gold. In my, that's just, that seems like cruel and unusual.
I actually love root canal. That's my favorite thing to do. Um,
And see, that's because you're doing it, not because you're having it
yeah,
done.
yeah, that's true. But I mean, listen, first of all, like, every tooth, like, it has like its own like little roots, right? And then every root has a canal. And so, like, when you're getting a root canal done, like, you're literally going down each canal, cleaning it out, like getting all the gunk, all of the debris, all the bacteria. And that takes time, because unlike doing a regular filling, you don't have direct vision. Like, when you're doing a filling, you can look at the tooth, you can see what you're drilling. With the root canal, the roots of the tooth are underneath the gums. So everything that you're doing it based off of just really feel and instinct, and you're taking X-rays so it's a lot more. It is tedious, but there is a lot more to it. But
Right.
I have one too. I mean, I had a root canal and mine was fine. My experience was fine. I think you know what it is? I think you hear horror stories because a lot of times when it gets to the point of the root canal, right? It's similar to what we
Right.
talked about. By then the problem's already in the nerve. So the patient's coming in there fired up, their mouth, their tooth is hurting, they're in all this pain. So that's why. So they associate that whole entire experience with the pain. But honestly, had they been going or had they been taking care of the issue to begin with, it wouldn't have progressed to that. There are three layers of the tooth. You have the enamel, which is the outer layer that you can see. You have your dentin that's located underneath your enamel, and then you have the nerve. Once a decay hits the nerve, then it's unreversible. But everything, but I mean, it had, like I said, had whoever taken care and kept up with their dental treatment, anything that's in the enamel or in the dentin, you can just solve by filling. So, or getting a filling.
Yeah. I'll say this. I have a dentist appointment on Monday. Monday, not this Monday. I think it's like next Monday. And you really not making me feel warm and fuzzy about it. I mean, I
No,
feel like I got stuff growing in my mouth. You keep talking about
oh my
bacteria. I
gosh,
mean,
we all have it. We all have it.
ugh.
You're fine. You have a beautiful smile. It's nice. Like, come on, come on. You have a beautiful smile.
Listen, he said, my poor husband, you see,
Really?
he is really going through it. Like getting him to schedule this appointment was almost as hard as it is to get my 13-year-old to do stuff. Like he really
Oh,
has an aversion to dentists. Yeah.
oh.
He's like for real. It's
What are
really
your
bad.
what are your top three recommendations for dental health?
Top three recommendations. Definitely brush and floss at least once a day. Um, then also do a rinse. I like to use ACT rinse, because it has fluoride in it. And what I do is, I'll floss first, I'll get all the gunk out, I'll brush my teeth, and then I'll rinse with Act, and I won't eat or drink anything for 30 minutes.
Oh,
And I like it because it has fluoride in it, and fluoride works to help kind of remineralize the tooth. So, like I said, the bacteria that live in your mouth, they produce, an acid that breaks down the teeth, and that's what causes, decay and cavities. But fluoride, it helps remineralize those surfaces of the teeth that the
okay.
bacteria is trying to break down. So I like that. And then another thing is just go to your regular checkups every 6 months. Yeah,
Now
so
you talked about the fluoride. Now, do most toothpaste uh have fluoride in it?
yes, most toothpaste do. I think like the Toms or like sometimes those natural toothpastes, they don't have fluoride in it. I would kind of stay away from those. And then another tip that people don't know is when you're brushing, a lot of times people they rinse their mouth with
Mhm.
water after. Don't rinse your mouth. Just kind of let the rest of the toothpaste sit in there because it has the fluoride in it, right? And if you want it to work towards remineralizing your teeth, once you rinse it with water, you're rinsing unless you do the Act toothpaste after that. But once you're rinsing with water, you're rinsing all those fluoride ions away. So yeah, people don't know that, but you're really not supposed to rinse your mouth with water after you brush your teeth.
Well, what about like mouthwash? Is that bad for your teeth? Like Listerine, is that bad?
Um, it's not bad for the teeth. I just think that Act works a little bit better. I think Listerine, I think a lot of people use that more so to control, the halitosis and the bad breath. But I think if you really want to focus more so on like rebuilding your teeth and protecting them against cavities, it's something like Act is probably better.
I'm still stuck on the don't rinse with water.
Right.
Um, so maybe I'm brushing my teeth wrong and completely taught my kids how to brush their teeth wrong.
Right.
But how
So
How
we
am
all
I
have.
getting
I did it too. We all have. We all
how am I
have.
getting everything out of my mouth if I'm not rinsing with water?
So okay, could you can still spit out,
Okay.
the excess toothpaste, right? And you can still spit everything out, but just don't rinse with water after that. Because
But the tube says don't swallow it also.
well, you don't swallow a big like chunk or a big tube of toothpaste, but I mean,
Right.
yeah, but I mean, at that point, there's already water in there. Everything is foamed up. You know what I mean? And like, you can still like spit it out, like whatever the excess is. You shouldn't be, taking a big gulp or anything.
Okay, I'm gonna try it tonight. I'm gonna try it tonight.
Yeah.
I'm gonna try this tonight with no water.
Okay, so I know you said so the act for the mouthwash,
Mhm.
are there certain brands of toothpaste you would recommend? I know you said try to kind of stay away from those natural ones. They make your breath stink anyway. I don't know why
Yeah.
people use them.
Yeah. I've never used them. I don't like that.
Yeah,
Oh,
they don't get, they
no.
don't do anything for you.
Yeah. Yeah. I would say, I don't have any particular one. I mean, they all pretty much do the job. I use Arm& and Hammer, just because it has like the peroxide and the baking soda for the whitening. Some people like Crest Pro Health. I mean, it really, some people use Sensodyne. As long as it has fluoride in it, that's all you need. Because what works for me may not work for you. Arm & Hammer may be too harsh, for people that have sensitive teeth. So, I mean, Pro Enamel, I know that, that works pretty well. But again, it really has to do with, preference and what works for you.
Okay, so what about those? I've seen people, and I don't know why it weirds me out. Probably because it's black, like that
Mhm.
charcoal.
Yeah, no, I wouldn't use that at all. I would say if anything, do like the Arm& and Hammer, but no, because it's an abrasive, like the charcoal, and I don't even know that those like types of toothpaste or just putting raw. I know for sure putting raw charcoal on your teeth is not approved by the American Dental Association, and the issue with that is that it's harsh. It's an abrasive, and you don't want to wear away all of your enamel. Again, you only get one set of teeth. And so, when you start wearing away and like, basically like sandpapering your teeth down, what are you gonna have left? So yeah, no, I would definitely steer clear from that. If you want to whiten your teeth, like I said, Arm& and Hammer, they also have Crest white strips. Visit your local dentist. They can make you some whitening trays. Like there are other ways to get around it, but anything that requires you like scraping your teeth and putting charcoal on your teeth, like if that were the case, we would have been doing this for years already. Like
Wow. Okay.
yeah.
I mean, I don't think I could do it anyway. The fact that it's all black,
Yeah.
it's a turn off for me. But like I've seen it, and excuse me, I've always kind of wondered, like, is
Does it
that
actually work?
normal?
Yeah,
Yeah.
no. Mm-mm.
Okay. And what about brushing your teeth with baking soda?
Um, that's another thing. Is I I can't speak on like because I know for sure that like with Arm& and Hammer, and that's why I use the Arm& and Hammer with baking soda. It's a dental grade baking soda, so it's not like the
Oh,
particles aren't as harsh. So it's
gotcha.
not stripping your enamel away.
Right.
There's something. Put it this way, like I don't use anything on your teeth that wasn't specifically intended for to be used on teeth.
Gotcha.
So.
No, that makes perfect sense. But in our culture, we find
Yeah,
some, put a little of this on it.
yeah, yeah, yeah.
We
Use
gotta
Arm& and
fit.
Hammer. I mean, use that's why I use it. Just use the Arm& and Hammer. Your
Yeah,
breath
we
isn't as fresh with it, but I like it.
okay.
So let me ask the question about wisdom teeth.
Mhm.
Um,
Oh,
so I don't have any issues with my wisdom teeth, but my family, they have had issues with their wisdom teeth. Why in the world do they grow if we're just told to take them out?
Right.
Like,
Mm,
what's like what happens there? What's the issue that some people need to get them taken out?
so sometimes, so a lot of people, their wisdom teeth can grow in and they won't have any issues. Some people, their wisdom teeth, they grow in horizontally or they start pushing, and, shifting other teeth, because their mouth isn't big enough to hold all of them. Some people, so with me personally, my story is like, my wisdom teeth, they came in, they all came in straight, my mouth had enough room for them and things were fine. The issue with me though is which is what I find with a lot of people, apart from their mouth just not having enough room for the wisdom teeth, is that the wisdom teeth are all the way in the back, obviously, right? And it's difficult to clean those areas of the mouth clean. And so because of that, the wisdom teeth are most commonly the ones that, if you still have them at least, that are more prone to decay and other infections because they're all the way back there. It's difficult to reach back there with a toothbrush. And so a lot of times, just to be proactive, like we'll tell patients, you know what, you already have a couple of cavities back there. It's best to just get them out. I mean, we can fill them, but another thing about filling cavities is that if you're still not keeping the area clean, you can get what's called recurrent decay, and a cavity can form on top of the filling that was already done. And so it's gonna become a recurrent problem. So before it gets to that problem, why don't you just pull them? They don't really serve any purpose. You have two other molars that you can chew with. So, and that's kind of what happened with me. Like I had my wisdom teeth for a long time. And I had two cavities in them. And after I got the cavities filled, I had some tooth sensitivity. It was still causing me some trouble. And I'm like, you know what? I don't want to deal with this anymore. I don't even need my wisdom teeth. So just take them out. And that's what I did. So,
Wow. Okay.
yeah.
So anything else you want to share you feel is pertinent that you want to share before we close out?
Not that I can think of. Well, thank you guys for having me. It was lovely talking with you all.
Well,
And
thank
thank
you
you.
so much. Ladies, any
Thank
other
you,
questions?
Ariana. I just want to say, Ariana, I'm just so proud of you. Just so proud of you. And you're doing
Aw,
the thing.
thank you. Thank you.
Yes, it is always great to see another Black woman,
Yes.
especially doing something she's always wanted to do, and then being able to get it done and be happy about it.
Thank you. Thank
Oh,
you.
he said, "Thank
Thank
you for
you
your
for the
scary advice."
scary advice.
Yes. So yeah, thank you so much for your time. I so appreciate it. I'm going to take you off. Just don't disappear just yet.
Okay.
All right. All right, ladies. So that was a great show. We are so thankful
Absolutely.
for Dr. Frank coming through and sharing her expertise with us and scaring the life out of my husband. That that is always fabulous. As usual, we're here. Um, why is somebody calling me right now? We're here every Tuesday at 8:30 p.m. Oh, thank you, Lisa. We're here every Tuesday at 8:30 p.m. With a wide array of topics. May is, however, Mental Health Awareness Month as well as lupus awareness. So before the month is over, we are going to have some special guests on to talk about both of those topics separately, of course. So stay tuned in, stick with us, and thank you always for your support. Until next Tuesday, you guys have a great night.